That's not your mic audio. We don't want that picked up.
All right. All right. The first thing I'm going to do before we start the meeting is just do some reminders. The first thing is going to start the recording now. By being present on the meeting and in the meeting, you are giving consent to get that started.
You're cutting in and out on me, Brenda.
Yeah, there's a lot of cutting in and out.
For me?
Yes.
There is?
Yes.
They said I'm cutting in and out.
Didn't they see you?
Yeah. They see that up there. So let me see. I'm going to mute this and just join by my phone, and hopefully that'll be a better connection. Sorry, everybody. Give me just a minute. Is this better?
Yes.
Is this better?
Yes.
Is this better? All right, hold on. Is this better? All right. Okay. Everybody good? Am I echoing 3 times?
You're good now.
I'm good now. Okay. Thank goodness. Sorry. Usually we don't have these technical difficulties. Okay, so just reminders again, it's recording. Mute your lines if you are not speaking. Make sure you say your name. I hopped on my phone. Make sure you say your name before you speak. And every vote will be a roll call vote. And thank you to IT for getting us started tonight. I did want to let you all know Fred is in our IT department. We hired him several months ago now, but he is being cross-trained to help cover these meetings and be able to do any of the live streaming or posting that we need if Evan needs to be out. So I'll go ahead and hand it over to Vivian, who is going to be covering for Paige, at least for the beginning of our meeting.
Okay, good afternoon, everyone. I'd like to call to order the Macon County Health Department Board of Health meeting for May 18th, 2021. Can we have a roll call, please?
Yeah, so I'll go ahead and hand it over to Sandy, we can't hear you very well. Is Kimberly going to do the roll call?
Okay, I'm getting a continued conversation.
I could hear you.
We're getting a delay. Okay, we'll try. Can you hear me?
Yes.
Okay. Paige Toth.
I'm going to go tell them to have read out.
Okay. Vivian Goodman,
Here.
Mary Jane Linton,
Here.
Phil Tibbs,
Here.
Candy Clevenger,
Here.
Jan Hack, Jan,
Here.
Dr. Jurger, Sue Kraus,
Here.
Dr. Meningati,
Yes.
Dr. Patterson, and Laura Zimmerman.
Here.
Vivian, you are muted.
Thank you.
There-
So we'll move on to approval of agenda topics. Are there any amendments, Brandy?
I would just like to add discussion of June meeting under new business, and that would be all.
Okay, can we have a motion to approve the agenda?
Laura, so
as-
moved.
Second, please.
Aye.
Who was, did
Mary
we get a second?
I second.
Okay, I'm sorry. Remember to state your name, please,
Oh,
for the
sorry.
record. Okay, roll call vote.
Really,
Are we ready for roll call? I'm sorry.
yes.
Yes,
So
I asked for, yes.
Vivian Goodman,
Yes,
Mary Jane Linton,
Yes.
Phil Tibbs,
Yes.
Candy Clevenger,
Approved.
Jan Hack,
Yes.
Sue Kraus,
Yes.
Dr. Meningati,
Yes. Yes.
and Laura Zimmerman.
Yes.
okay, thank you. Motion carried. Is there any public comment?
we did not receive any comment via email, but we do have a member of the public here. Do you want to say anything? Not today, so no public comment.
Okay. Okay, everyone received the Board of Health meeting minutes from April 20th. Can we have a motion to approve the minutes?
I so moved.
Laura, motion to approve, or second, Laura, second.
Thank you. And roll call vote?
Vivian Goodman,
Approved.
Mary Jane Linton,
Approved.
Phil Tibbs,
Approve.
Candy Clevenger,
Approved.
Jan Hack,
Approved.
Sue Kraus,
Approved.
Dr. Meningati,
Approved.
and Laura Zimmerman.
Approve.
Okay, motion carried. Thank you. Communication, Brandy?
We did not receive outside communication, but we do have just some updates under board education for the COVID-19 update. First thing, if you had not heard, the state of Illinois did move into the phase 4 bridge effective Friday, May 14th. And CDC had put some information out just the day before. if you hadn't heard that, about fully vaccinated people and what they can and can't do as far as masking anymore. So some big changes there very quickly. There was also a new executive order put out by the governor for Illinois yesterday. So we are very quickly getting ourselves updated and fielding a lot of calls and questions from the community in several of our divisions for people who are confused about the changes and just wanting to make sure that they're doing things as compliant as possible. So we're working with them to get that information back to them. The state has said that we could potentially move into phase 5 as early as June 11th. That's if the numbers go in the right direction and if we don't see some kind of spike or something. So we're just keeping an eye on that, and we'll get more information from the state. Contact tracing requirements have not changed at this point, and we have no indication that they will or when they will. If you recall, I did talk about the contact tracing grant was extended from that May 31st to December 31st. And we had the option of requesting additional funds in order to continue to staff those functions past that May 31st, since the expectations were the same and we would need staff in order to complete all of those functions. We did ask for additional funding. It was a little over 1.3 million in order to uphold what we're thinking would be primarily salary expenses throughout the rest of the year. We've not yet heard back. We should be very soon per what the state has said to us. So we're hopeful that we'll get some more funding for that. And then COVID enforcement, we're really not going out specially, but if we get complaints, we do call, we follow up, provide education. Of course, like I said, with the change last week with masking, we've had a lot of questions and people asking just to ensure if they do get complaints or anything that there is that compliance there. So again, just trying to partner with agencies, schools, businesses in the community and help them be compliant and as safe as possible. COVID guidance review and feedback. One of the things that we've been instrumental as an organization, and primarily environmental health, has been receiving plans or rules, policies, whatever it might be from different entities in the community. We never approve anything, and we make it very, very clear to them that that's not, in our area, it's not our jurisdiction, but that we are happy to review their plans and just give them any guidance on what they can do to be as safe as possible. So this is events, businesses, schools, anything you can really think of. They have called or emailed things in. So we just give them guidance because we, again, want to be their partner and just educate them to make it as safe as event as possible. Other update, there are variants in Macon County. So obviously that's a point of concern that we are watching because many of them are more transmissible. So definitely keeping an eye on that. We're able to review that via dashboards through Salesforce, which is that online contact tracing program that we adopted, if you remember. And again, keeping an eye on that as closely as we can. One of the bad parts about it is that the state isn't able to sequence the samples fast enough for them to get us information. So sometimes we don't know until someone's coming out of isolation or quarantine or they're already out of it that a case was a variant strain. So hopefully that moves along more quickly, but that part's pretty much out of our hands. So we're doing everything we can to monitor those and follow up as quickly as possible. So those are the primary things that I have about contact tracing. Still very busy. We have a lot of school lists coming in right now. And so that's taking a lot of the group's time. More resource requests for people needing housing and food or diapers. I mean, there's a lot of different things. We're continuing to partner with the public health navigators here locally and making sure that people get what they need. So very grateful to the team. Of course, we have the hired contact tracers, case investigators, but we do still have some other people throughout the building who are helping support or supervise all of these functions. So very thankful that they're still going after all of this time. And hopefully we'll see more of a light at the end of the tunnel soon. So if anybody has any questions about COVID updates, I'm happy to answer those, or if there's something that you feel like I missed, I'm happy to address that.
Okay, thank you, Brandy. Are there any questions for Brandy? Okay, if not, moving on, presentation and acceptance of financial report, Cherie.
Hi, everyone. The report is in your packet. The report is as of the end of April. So we were 42% into the fiscal year. The ending fund balance was at 4.7 million. Total revenue was a little over 3 million, which is at 40% of budgeted revenue, and total expenditures at 3.3 million, which is at 44.6% of budgeted expenditures. I also did want to add that the county outside auditors are wrapping up the audit. That should be completed soon, and hopefully I will be able to share some information with you on that next month or the month following. Also, you'll notice on the front page of this report, accounts receivable has not been updated the last few months. I am actually going to be doing some training this week in the new financial software to kind of clean up that process and hopefully provide some more accuracy there. So that's another change that will be coming to the report soon. If there's any questions, I'd be happy to answer those now.
Okay, seeing no questions, can we have a motion to accept the financial report?
This is Candy, so moved.
Second,
And second.
I'm sorry, I barely heard. Did you guys get it? Because
Jan second.
okay,
Okay.
thank you.
Uh-huh.
And a roll call vote, please.
Vivian Goodman,
Approved.
Mary Jane Linton,
Approved.
Phil Tibbs,
Approved.
Candy Clevenger,
Approved.
Jan Hack,
Approved.
Sue Kraus,
Approved.
Dr. Meningati,
Approved.
and Laura Zimmerman.
Approved.
Motion carried. Thank you. The department expenditures were in your packet. Hopefully everyone had an opportunity to look at those. Can we have a motion to approve?
Laura, motion to approve.
Thank
Mary
you.
Jane, second.
Thank you. And a roll call vote, please.
Vivian Goodman,
Approved.
Mary Jane Linton,
Approved.
Phil Tibbs,
Approved.
Candy Clevenger,
Approved.
Jan Hack,
Approved.
Sue Kraus,
Approved.
Dr. Meningati,
Approved.
and Laura Zimmerman.
Approved.
Okay, motion carried. Thank you. Are there any grant applications for review?
No, there are not.
Okay. The department division reports were in your packet as well. Does anyone have any questions for staff?
We do have representatives on the meeting from the divisions if anyone has specific questions. A few brief highlights I wanted to pull for you, as I know those are lengthy and we appreciate you looking at them because as you all know, there's a lot going on at the health department other than just COVID, and our staff's been very on top of continuing to provide those programs and services. We've had several more audits, site visits, and reviews, which are regular things, but those are going really well. One of the things that we are doing, we do compliance training. So it's HIPAA, safety. We do that every month throughout the year, and we are moving to e-compliance, which is a big deal. We're really excited about that. I think it's going to be more effective and also efficient throughout the building. Some of our programs are starting to look at transitioning back to face-to-face visits as they are starting to be more allowed by the grant funders and the rules and everything. So we're excited about that, but of course, making sure we're doing it the right way to keep our staff and our clients and patients as safe as possible. Vaccination demand dropped pretty significantly all of a sudden, but our team has been fantastic about conducting outreach clinics. And so they have been going all over Macon County to provide vaccination anywhere and everywhere that they're asked or can fit in. And that's community organizations, churches, homeless shelters, high rises for seniors, schools now for the younger population. We did also start having walk-in clinics after hours on Wednesday nights. Those have been very popular, so we're very happy about that. And starting tomorrow here in the building, we're going to be able to start vaccinating 12 and up with that other change that happened last week with Pfizer being allowed for 12 to 15. We're ahead on environmental health inspections. That's exciting. Things still going well with our IWIC transition. We are doing a panel discussion tomorrow night, which will be recorded and then posted on our website and social media. But that panel discussion is going to be specific to pediatric COVID-19 vaccinations. And we get a lot of questions just in general down in nursing that they handle. And of course, you know, people want to ask questions specifically when it comes to their children and making sure that they are safe getting vaccinated. So tomorrow night, several divisions are working together to hold this discussion. And we have several physicians that have agreed to participate. So including Dr. Miniganti, thank you again for doing that. So very thankful that these physicians are taking their time tomorrow night to do this with us and be able to hopefully address some vaccine hesitancy for parents. And then we have made some adjustments in dental with allowing walk-in, and I think I mentioned to you last month, but brought on a contractual dentist. And so that's been going well. So we're really happy to report that as well. And so that's all I have as far as highlights. If anyone has specific questions for me or for the division directors, you can certainly ask those now. Vivian, you're muted.
Sorry about that, guys. All right, seeing that there are no questions, we'll move on to employee recognition. May anniversaries are Deborah Fitton, 24 years, Rebecca Hartman, 19 years, Courtney McSherry, 18 years, Cherie, and I don't want to slaughter your last name, Cherie, 11 years, Katie Jacobs, 4 years, and Leslie Matthews, 3 years. So thank you all for your service and all that you're doing. Moving on to old business, Board of Health member appointment update.
Okay, so just wanted to provide you all an update from last month. The county board did add the appointments to our agenda. I think that was last week. Now the days are running together a little bit, but the appointments remain the same. So Phil, Candy, and Dr. McConty were reappointed effective in June. And then Debbie Hill and Mark Scranton are joining the Board of Health, and welcome to them. I have Debbie here, and I think Mark is watching, so welcome to our new board members. And then Paige and Mary Jane were not reappointed to continue on the board. So I just want to say a huge thank you to both of you. You have been instrumental on the Board of Health and in supporting the health department. And I hope that you will use your expertise and your passion in other ways in our community. We've been grateful to have you during your term or terms here. And so just thank you very much from me and from my staff. We've been very grateful to partner with you and to have your support. So thank you.
Thank you.
And that's all I have on that point, Vivian. So if you're good with me going ahead.
Okay, and ladies, I want to say thank you from the board as well.
Thank you very much. It's been a pleasure to meet those of you who I didn't know and to serve on the board. It was an honor.
Great. Okay, review and approval of Iplan.
Okay, so if you remember, several months ago, we did bring the Iplan to you before we submitted it to the state for their pre-review. If you recall, we did it significantly earlier than the deadline so that they could review it, just give us any suggestions for any improvements that they could make in order for us to make it the best document possible. And so now we have, our team has edited it and made those improvements. And so what was in your packet is our final Iplan that we would like to submit to the state. It is due in July, but as long as you approve it this evening, we will be submitting it here in the next few days. There is a letter, if you saw, that Paige as president and I will need to sign. And so if you approve, I will get that to Paige as soon as possible. And yeah, if you have any questions, you can certainly ask those now. Marissa is on the meeting. So feel free to ask any questions before you would make a motion to approve if you have those today.
Okay, does anyone have questions regarding the odd plan? Okay, seeing none, we'll entertain a motion to approve.
Laura, I move we approve.
Thank you, Laura.
Mary Jane, I second.
Thank you. And a roll call vote, please.
Vivian Goodman,
Approved.
Mary Jane Linton,
Approve.
Phil Tibbs,
Approved.
Candy Clevenger,
Approved.
Jan Hack,
Approved.
Sue Kraus,
Approved.
Dr. Menenganti,
Approved.
and Laura Zimmerman.
Approve.
Okay, motion carried. Thank you. Next item, review, discussion, and approval of paid parental leave policy.
All right, so if you recall, last month we did bring this policy to you for a vote. We had, previous to that meeting, submitted the policy to Ed Flynn, the attorney that we use for human resources needs per the county, for his review. And if you recall, his only question or concern under that first review was if, we might have staff that are upset who previously had adopted or had children and did not have this benefit versus the ones moving forward that would possibly have this benefit. One of our board members last month did ask the question about, is there a chance that this could then result in a disparity of benefits with people who do not have children? So we did, as we promised you, we did take it back to the attorney, Ed Flynn, and had him review it again. In your packet was his formal letter that he wrote back, just basically after reviewing it, his thoughts. I also presented your thoughts and questions with that when I sent it back to him for a request for re-review. So basically, after reviewing that letter, it appears that you still have the option to approve this policy as a board if you choose. It seemed as if, one of the primary concerns was possible criticism or just not the same benefits from one county department to another. And so I definitely would like to hear any thoughts you have. This is ultimately up to the board. This is definitely something, as we talked about, that not everywhere does. We're kind of behind in the United States a little bit for some of these types of leave. And so that's where the direction that I and my team were trying to head is just trying to kind of be a little more proactive about these things and support our employees and support an environment where parents could be with their children. I think that's kind of one of the staples of public health. So I also definitely understand where he's coming from and the concern about disparity in benefits that a board member brought forth. So I will stop talking and let you all discuss and decide if you want to vote on it or if you do not want to vote on it. And if you have any questions, I'm happy to answer them.
Brandy, I've
So
been thinking about this, and I was wondering, especially when he said the disparity between different county departments, can you just remind me, though, our employees in the health department compared to other counties, we're still, I know we've been trying to bump that up, but we're still kind of on the low end of that, right?
Yeah, of course, as you all know, the other county departments are different in what they do. So there's not always an apples to apples comparison with your
Well, between like other county health departments, are we on the low end of still, even though we've been trying to bump up the salaries?
We are, from our understanding, we are working on a salary assessment right now, and I'll go into a little bit more detail about that just to get you all updated on where we are. But yes, comparable to other health departments, we have been on the lower side. For those of you that have been privy to health department information for many years, in 2014, there was a salary survey that was done, and we were shown to be, I think it was 25% significantly lower than other comparable health departments. And so we did, in the budget do increases and we to the current staff, and then also did some increases to our base pay for what we would bring people in at. We expect that we are still lower in some of the job postings that we have been seeing and monitoring. Bethany keeps an eye on those. We are lower in some cases. And then when you, of course, compare us to other healthcare organizations, other types, we're significantly lower. So that's definitely something that we're looking at. And yes, I think sometimes, not sometimes, I know from being here and from serving in human resources before this role that some of these other things like benefits that we are able to offer to people are what help us get people into the building and keep them here once they're here, which is a really important part of it. So I think benefits are really important. And I mean, I could go on about some of the benefits that we have or the way that we do things that I do think keep people here. But this is definitely something that, yes, I wanted to, again, try to support parents, whether they were adopting or, had a child, new baby, grown child, whatever, and to support that as much as possible and make sure that people could afford to do that as well. Because, of course, people can use their benefit time. We also have FMLA, which is unpaid. So it's not really a matter of someone getting their entire maternity or paternity leave paid. It's just a matter of supporting that and helping offset some of the financial burden that is experienced by these parents.
Right. Well, yeah, that's kind of my thought, that since we are on the lower end, I think giving an additional benefit is a positive. That, like you said, having that on the books, it might be a draw for some people, and at least show that we care. But also, I think that goes to, if other county departments want to criticize us for offering this additional benefit, I know that a lot of our other county departments are middle range, not as compared to comparable other counties. So, they might not really have a leg to stand on in terms of, if their salaries are already more comparable than the health departments, then adding this additional benefit is the least that we can do. And like you said, I think it's an important thing for a health department, especially to offer, that we show that we care about, families' health. So I'm totally in support of this. And I think that we should prove it.
I am in support of it as well for the same reasons. I think it shows that we do value family, we do value parenting, and set an example for those who don't have. I mean, it's not that they don't value it, but I mean, set an example as that as a benefit for parents.
Any other discussion?
I did want to just make sure you all are aware. I did hear from a board member who's not on tonight, so I do want to just make sure that voice is heard. That board member did concur with the thoughts of not wanting to give more benefits than what some of the other county departments do, and in not wanting to be, a trendsetter per se in this area. So I do just want to be, completely upfront about that person did provide a different perspective than what's being discussed right now. So I just wanted to let you all know that.
And just briefly, this is Phil. I'm sorry.
Go ahead.
I would agree with the other board member that's not present, and agree with Ed's letter. I think there should be some consistency with the county departments. We are on the county's health plan. The other benefits are similar, and I don't necessarily think the timing's right at this time to do that. So I would be against it at this point.
Any other discussion?
Yeah. I agree with Phil. This is Candy. At this point, I would not be in favor of it. I just don't think the timing's right.
Okay, anyone else? And I would just add after reading the letter from him, I did have some concerns about the legal aspect and maybe some problems that it could cause.
And I do understand that aspect, that the legal issues. I do understand that. We would have to consider that too. That is true.
Okay. Any other discussion? So we'll entertain a motion.
Well, I think that it's in, I mean, I don't know, it doesn't sound like that too many people are in favor, but I don't know if we need a motion and just, vote it down or just, but I like I said, I think it's important. So I would like to make a motion that we offer, do we have to decide on like the number of weeks? I don't remember if that was in the motion, but
mostly about last time, so.
okay. Well, yeah, I would like to make a motion that we do add this, a paid parental leave policy. And at least just have a vote on it. So I'll make that motion.
Okay, is there a second?
This is Sue Krause. I'll second that.
Okay, can we have a roll call vote, please?
Kitty Goodman,
No.
Mary Jane Linton,
I'm going to abstain. I have both feelings both ways, so I'm going to abstain. Is that allowed?
Yes. Yes.
Phil Tibbs,
Be a no at this time.
Candy Clevenger,
Candy is a no.
Jan Hack.
Yes.
I didn't hear you, Jan. I'm sorry.
Yes.
Thank you. Sue Krause,
Yes.
Dr. Meningati,
If I may, I'll abstain at this point. I still need to get more. I mean, I had to be honest with you guys. I mean, I haven't gone into the details of this policy, to be honest. So I cannot vote yes or no, although I understand the feelings behind this. I do understand that they need the parental leave. I'm not saying no, but I have to read. It's just from lack of time. For obvious reasons, I could not go into reading the details of this policy, so I can be voting yes or no at this point in time.
and Laura Zimmerman.
Yes.
So I'm sorry, what is our count on?
I have 3 yeas and 3 nays.
And 2 abstains?
Yes.
Okay. So it looks like for now, Brandy, it will not pass.
Thank you all for working through that. Appreciate it.
I would like to say as an after fact, I do think it's an important idea, but it makes me nervous about the right now issue because I think that maybe people know more than I do about it right now. And so that's partly of my vote. I mean, I think it's important, but legally, I don't know.
Okay, thank you.
Lawsuits are expensive.
So moving on, update on goals and future projects.
Yeah, so I thought that this would be a good meeting to just provide some updates to some of the things we've been talking about. over the last, 2020 and 2021. Specifically, with having a changeover of some board members, I wanted to make sure that the outgoing board members heard an update, and then of course our incoming board members could hear a little bit more about kind of some of the bigger projects that we have going on right now. So one of the major goals that I had listed for 2021 was to research, evaluate, and choose the most appropriate digital system for the environmental health division. Potential recommendation deadline to the board is October of 2021. And I know that environmental and IT have been meeting about that and watching some demos and things. So they are moving along. Very grateful for that. That is something we tried to do years ago and unfortunately didn't pan out. So I think this is our year, and I am really excited because this is going to help with efficiency. And then when we give people a report after their inspection, it'll always be, very easy to read and then easier to upload on our website. So more to come on that, but I just wanted to let you all know that that is moving. And then second goal, research and implement a salary assessment. Potential recommendation deadline, May of 2021. So what that meant for recommendation was that at that time we would recommend to you what company was going to do the salary assessment. We've done a lot of research and have not been able to find a company that would be able to conduct a comparable assessment for us in the way that we were looking to do it. However, a few other things have happened. So Bethany had already started doing some work on gathering information from other health departments so that we can try to do as much of a direct comparison for different positions as possible. And we also are partnering with other administrators from other health departments throughout the state who are also interested in doing this. So there are a lot of health departments that are on board with exchanging this information as quickly as possible because they need it as well. And then we also are going to have an intern who will be starting somewhat soon that is going to assist with this and gathering the information, getting it in a nice reportable format and all of that. So that is also moving, and I would expect we will have information before the implementation deadline of October 2021 because Shree's already working on our budget for next year, and this information is something that we will need for that. And so that also is going to be moved as quickly as possible so that we can make it valuable for this year. Third goal, continue local pandemic response with continued implementation of contact tracing and upcoming implementation of mass vaccination. Potential completion for contact tracing, May 31, 2021. That was that original grant end date, if you recall. Now, of course, that's been extended, and we have no end date as far as when contact tracing will end. The grant is going to be extended through December 31st, but of course we know that the state could say, next week we're going to stop doing it or something of that nature. We've been communicating with the contact tracing team that we want them to stay on board as long as they're willing, since the time period has been extended. But that, of course, we understand if they cannot, but we've lost some because they had other plans for the summer. They've had other obligations come up, but we do have still a strong size team, and we're keeping an eye on that all the time because we certainly don't want there to be a spike and not have enough people to respond. So I think we're in really good shape there still, and we're still well above the minimum number of contact tracers that we have to have. And then the potential implementation for mass vaccination was December 2020 to ongoing. So of course, you all know we've been vaccinating since December. So definitely hitting on that. I did want to say these were not necessarily in goals, but I didn't want you to think they have fallen off of our radar at all. Electronic health records is something, if you recall, in 2019's budget for FY20, so starting December of 20, December of 19, I apologize, into 20, we did get approval to pay for electronic health records out of our health fund. If you have been on the board a while, you've probably heard the auditors say that they recommend that we get electronic health records. For many years, that was not done because the cost is so significant, and the benefit in what we have here at the health department just didn't, explain the cost. It just didn't make sense. Because this keeps coming up on an audit, then we did decide that that was something we were going to move forward on. I did want to let you know that that also is not off our radar. And we did get approval in our grants for COVID to pay for the electronic health records out of that grant funding. So what's good about that is that we don't have to use the health fund dollars. We can continue to hold on to those in case we have to get into them at some point. The more difficult thing is obviously that bumps up our timeline to ensure that we have all of that implemented before that COVID related money ends. And then the other thing that we've talked about for quite some time is getting a new phone system. And we did get grant funding for that. Or we were able to get it approved in the grant funding, excuse me. So we don't have to pull that out of the health fund either. And we have worked with state's attorney's office, and we did do an invitation to bid letter that's posted. We put in the paper, all of that. So we're going through that bidding process, and we're really excited to continue to move forward on that as well. So any questions about any of the goals or upcoming or current projects that I can answer for any of you, or anything that you feel like I missed that you would like me to elaborate on?
Any questions for Brandy? Okay, thank you, Brandy. Moving on to new business. Finance Committee meeting and follow-up update.
Okay, so I just wanted to provide an update. I did send you some information just about the Finance Committee meeting that was held on May 3rd of 2021. There were some questions presented about if we had paid any bonuses to staff or overtime payouts. And so as far as bonuses, we only pay a nursing sign-on bonus, and that's been happening for ever since I've been in HR administration here at the health department. That's a $1,000 sign-on bonus that's paid in 3 installments at 3 months, 6 months, and 1 year. Otherwise, we do not pay pay bonuses, excuse me. Overtime, of course, we do pay overtime when non-exempt employees get to that 40 hours or more. By law, you have to pay that overtime. We have always done that, or done it in hours, because we're a government entity, we could do hours, but we have paid that out. And then if you all recall, we have done flex payouts, which are straight time. So just to walk you back, if you recall, back in March of 2020, there was a temporary COVID policy adopted that allowed staff to earn over that regular 35 hours of flex time because of the emergency situation. And so we did have several employees that were working significantly over their regular amount of hours for the week. And so that was a way to allow them to earn that time to use later. So fast forward to us finding out that we could pay that time out of those grant funds. So the grants would be the COVID crisis grant, local cure, contact tracing, and mass vaccination grant. And those all allow for overtime to be paid to staff who are associated with or involved with the COVID-19 work and response. And so we started in September, and we've talked about this several times. I know we did, talk about it in EEHW, which is our oversight committee with the county board, finance committee, and then of course Board of Health and full county board. We've had some resolutions go through, but we've talked about the overtime that was being paid out or allowed to be paid out through those different grants. And so we did not pay that until September. So between like February, March, depending on what the person's role was, and then through September, staff were working that, not knowing they would get paid out for it, because usually we do not get paid out for flex time unless if someone leaves. And that's just been the practice for many years. So, and stop me if you have any questions, because I feel like this is going to be kind of a long report. So please feel free to interrupt me if you have something you want to ask. Okay, so this is allowable expense in all of these grants, and we do have documentation for that, whether it's in the form of the actual grant contract, or if it's in a NOFO or an NCFI for the grant, that it is in there. I will say that we have not paid any flex time since the March 5th paychecks. The reason for that is when we started with the new time clock system. If you recall, we adopted the new EWS time clock that is linked to the county's MIP accounting system. So our time clock is directly linked to the payroll system with the county, which is great. And the time clock actually has staff record what program or service they are working in for like every minute that they work. And so it has extreme accountability. We are able to provide that information to our grant funders to show that if we claim 30% of someone's pay, that they're actually working 30% on that grant. And so we did adopt that in March 5th. So we've not done a flex payout since then, because we wanted to make sure everything was flowing correctly. with all the leave and accrual balances and all of that in that system. So we do plan to do another payout in June of that time for in between the March 5th and the June payroll date that we will pay those out. So far, of all, and I sent you information about, the amounts, but we've gotten so far without this extra funding, we've requested $3.5 million of grant funding specifically linked to COVID-19. And all of the flex or overtime payout ended up being 6.98% so far of that amount of the 3.5 million. And I will say, and I did clarify to the finance committee that evening that I presented and answered questions, that most of the people on this list, there were 33 people on the list so far out of about 140 to 150 employees. Most of those people are getting paid straight time, so it's not time and a half overtime. Just so you know, if that helps at all. As I said, I did attend the finance committee meeting at the request of Chairman Greenfield just to answer any questions. Answered all the questions. There weren't a ton of questions. The verbatim minutes from that meeting are posted on the county website if you want to review them. I'm happy to send them to you if you like them or if you didn't get a chance to look at them before. But they are all there so you can see what questions we were asked, what information we provided. And I was also listed on there. So Chairman Greenfield did ask me some questions about who has approved mine and did I do that on my own and what's the accountability there. And so I did tell him that Candy, who was president at the time, did approve mine to be paid out, but only over 50, not over 35 hours. The discussion, and I'll let Candy add if she wants to, but was that obviously in my executive level position that you work more than everybody else in the building, you're expected to. So instead of mine being paid out over 35, mine's paid out over 50. And so going back here. Okay. So I answered questions at the finance committee meeting and that all went fine. And there was the media there. They didn't ask me any questions or anything. And then the next day I did receive a request from Assistant State's Attorney Mike Baggett requesting more information to elaborate for Chairman Greenfield and the Finance Committee. So we did get him everything by the next business day. And then I did speak with him, I think it was at the end of last week, and just told him, if you want the NOFOs and all this other stuff, I'm happy to send that too. Just let me know. And he said, go ahead and send it. And then that way he just has it. So I sent all of that to him as well. And that's where it basically outlines that overtime is an allowable expense, payroll expenses are allowable, all of that, because all of that was checked, obviously, before we did that. So things that he requested in that email were time clock records from January 2020 to present, copies of the resolutions that were passed through the county board, copy of the policy that was passed through the Board of Health. And I think that's it off the top of my head. But again, we got that all in the next day. I haven't heard anything. I don't know if I will. So I just wanted you all updated. I did tell Chairman Greenfield when he called me the first day just asking questions about it. He said a reporter had reached out to him and he just wanted to get out ahead of it. And I just told him, yes, we've talked about overtime and paying that out in, several meetings. I did that. I wanted to make sure I was being as transparent as possible in case this ever was questioned, because, certainly not trying to hide anything, just trying to use grant funding to pay people for the actual hours that they worked. As you remember earlier on in the COVID-19 response, we had no funding and had no word of any funding. So our small team of people that were kind of like the COVID response leaders were doing pretty much everything. And then others sprinkled throughout the building were helping with contact tracing as numbers grew. And so, again, there's 33 people on the list. All of them make sense if you look at them as far as what those people's roles were and what they were doing, what they've had to cover. And so I told him, I stand by this, and this is something that I've, talked to the boards and the committees about. So I'm happy to answer any questions whatsoever. We definitely don't have anything to, hide at the health department. So I haven't heard anything back after sending all that information last week. I think I sent it Wednesday to Mike Baggett. So any questions or comments or anything at this point?
You know, Brandy, I did reread the policy for the flex time accrual, and I remember the vote on that. Do we have a current policy on flex time payout?
So the current policy states that it can be paid out if approved by the administrator. Like I say, it's not right. It says something to the effect, I don't have it pulled up. I can pull it up, but something to the effect of it's not regularly paid out, but can be. I can pop it up and read it to you if you want me to, if that's helpful. No.
But there's no specific policy though about it.
No, not a separate policy.
Right.
No.
And as far as the other approval, you said, and I think the minutes from the committee meeting said that the board president had approved your flex payout. Is that in the policy as well, or does that require full board approval?
No, that's not in the policy either. So, okay, so let me reverse a little bit. I'm getting ahead of myself. So I'm subject to the policy manual. I'm an at-will employee like the rest of the employees here at the health department. So I and former administrators have been eligible to earn that flex time over 35 hours. Obviously, I'm in a little bit different of a situation because it's, you know, not to say the other administrators didn't work very hard, but this is very different than in those situations. And so any other administrator has also been subject to the policy manual. So I actually earn flex time over 35 hours. Of course, I'm not ever, you know, going to be able to use all that or anything. And so before I allowed for myself basically to get paid out, I did talk through that with Candy because I wanted to be transparent. I wanted to make sure I wasn't doing anything that it could appear to be, you know, shysty in any shape or way. But I am subject to that policy, and that's been the way for as long as I can remember with administrators here. So.
Okay, thank you. And the only thing that threw me a little bit is I was caught off guard when all of this came up because as a board member, I had no idea that we had started paying out this flex time. And so I didn't think that was completely transparent to the board members.
Well, and if I didn't, I mean, I know that we talked about overtime a lot and the excessive amounts of hours that staff were working. So I guess I kind of thought that that covered it. I know that, I can't say which meeting, but I know once I heard from him and knew I was going to be presenting at the finance committee meeting, that I did print everything just to have all my documentation ready, got everything prepared so that I could answer all the questions as good as possible. So I think I specifically referenced flex payout during one of our meetings, but I generally said overtime just because that kind of encompassed everything. But that was definitely not meant to be trying to elude anything or make any kind of false presentation. I mean, if we had paid overtime to staff, this would have cost significantly more, but we've paid straight time rather than giving overtime. And I know that we did talk about it when we went through a lot of the grants and all of that. So if you feel like I wasn't completely upfront, I apologize for that. I certainly try to be extremely upfront with all of you and communicate. Probably.
No, I'm not saying I don't think you were upfront. I'm just saying I wasn't aware that it was going on. And then I had a phone call from one of the board members asking me about it, and I was clueless. So.
I just want to add one thing, Brandy, because I think I was caught off guard because some board member told me that we were paying bonuses, and I said, well, I don't know what's going on with that. And I think that made it look like there was more confusion than there was because you're not giving bonuses. So in case that comes up, this isn't response to you, Phil, because I totally get that. But if somebody talks about me being confused about what we were doing, the reason is because they were telling me things that weren't true. So I just want to clarify that for Brandy and everybody else on the board in case that, or the health department in case that got passed around too. But so.
Phil, you're muted if you're saying something.
I thought Vivian was talking and she's muted.
Oh, I was actually. Are there any other questions or discussion? Okay, if not, thank you, Brandy.
Vivian, can I just one more thing?
Okay.
I do want to say, if you didn't get a chance to read those finance committee meeting minutes, Mike Baggett was at the meeting, and Chairman Greenfield did ask him if there was anything, illegal about what was being done, and he said no. Now, of course, they're reviewing more documents, so I don't know exactly what that means, but I do want you all to know that. And like I said, we do plan to go ahead and pay out in June unless there's someone that wants to object to that, or if you have concerns with it. I do not. I will tell you, we did also hear from the auditor and auditors that everything looked in order. And so, yeah, so if you're okay with us proceeding, that's my plan, to continue to do that. It lowers the financial liability for the health department later, and it's been approved in our grant budgets. And so as long as you're good with that, I will continue to proceed.
Okay. Any other questions? Do you need a vote, Brandy, on, or?
No, that was just, I just wanted
Yes.
you all updated and.
Okay. Okay, next item, nominations for board officers.
Okay, so this is just a discussion point. This is no vote. I just want to clarify, we're not trying to hurry up and elect any officers before our new board comes on. So I just want to be very clear about that. As you all know, in our bylaws, it states that our election of officers occurs in November. So there can be nominations brought forth in October, and there can be nominations brought forth in November prior to the vote during that same meeting. And then when there's a vacancy in a position prior to a term ending, you are to fill that vacancy as soon as possible. So with Paige going off of our board, she is our president. And with Mary Jane going off of our board, she is our treasurer. And so we will hopefully vote next month if you're ready. If not, July would also be fine. Vivian will be covering the meeting next month as our vice president until we can get a new president elected and everything. So I just wanted to put this on here because I want it to be on everyone's radar that we do have these two positions that need to be filled. If there's anyone that wants to make a nomination or nominate themselves, of course, that can be done. But then we will need nominations next month and or July to get the election done so that we can make sure we don't have those vacancies for too long. So that's all I've got. I'll let you board discuss.
Okay, any discussion? Okay, thank you, Brandy. And last item, discussion about the June meeting.
Yes, thank you for letting me add this. I just wanted to let you know, and I did talk to Paige and I did talk to Vivian. I will not be able to be present at the June meeting. So Bethany is going to cover. Of course, she's our assistant administrator. Bethany is going to cover the meeting. If it is virtual, I may be able to attend. So that kind of just depends on if there's still a disaster proclamation or not. And so I did talk to Paige and Vivian about did they prefer to reschedule so that I could physically be the one there, or were they okay with the coverage? They both felt as if it was good to just keep it the regular night, that rescheduling was not needed. I am fine with whatever the board wants to do. I know Bethany's fine with it. I know that with new board members coming in, that this is not the best month for me to miss, so I apologize for that. But Bethany is extremely informed about what's going on at the health department, so she should be able to answer any questions, even if I'm not allowed to join virtually if we're back in person next month. So board, I will let you tell me what you think, if you're good with keeping it that same day and having Bethany cover, or if you would like to reschedule.
I think we're good with keeping it that same day.
Is everyone okay with keeping it?
Yeah, that sounds
Okay.
good.
Yes.
Any objections? Okay, seeing none, we will go on with the regular meeting.
All right, sounds good.
Okay, and was there anything else, Brandy?
No, that is all.
Okay, so we'll entertain a motion to adjourn.
Phil so moved.
Laura, second.
Thank you. A roll call vote, please.
Vivian Goodman,
Yes.
Mary Jane Linton,
Yes.
Phil Tips,
Yes.
Andy Clevenger,
Yes.
Jan Hack,
Yes.
Sue Kraus,
Yes.
Dr. Meningati,
Yes.
and Laura Zimmerman.
Yes.
Okay, motion carried. Thank you all. Stay safe and we will see you next month.
All right. Bye.